Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health. And let me first send my best wishes to the Punjabi community as they celebrate Lohri, our Tamil community as they celebrate Thai Pongal, our Hindu community as they celebrate Makar Sankranti, and our Orthodox community as they mark the new year. I wish the very best to everyone celebrating these occasions, and I remind you to please celebrate safely. I know the big news on a lot of people's minds is children returning to in-person learning this coming Monday. I know many parents and students are happy about this decision, but I also know that there's a lot of anxiety about kids returning to the classroom. That's understandable. Along with my fellow Ontario big city mayors, I do believe that the benefits of in-person learning at this point outweigh the risks with the measures that have been taken by the province and our school board's partners. Without a doubt, in-person learning is best for the students' academic success and their mental health. Schools should be the last to close and the first to open. And thankfully, we are in a very different position than in previous waves. We now have a highly protected and highly vaccinated population with many educators and school-aged children either partly or fully vaccinated. What's so important now is that all education staff and parents of school-aged children in Mississauga get their first, second, or booster shot when they are eligible. I want to thank the province for prioritizing boosters for education and childcare staff. I highly encourage eligible staff to book a booster at the International Centre by calling 1-833-943-3900 or at our other designated location at 6585 Airport Road by visiting fh.vax.com. Yesterday, we heard from Education Minister Stephen Lecce that the province has shipped more than 9 million F95 masks for staff and 4 million three-ply masks for students to school boards across Ontario. We're also sending an additional 3,000 standalone HEPA filter units. The province also plans to send each student and staff members home with 2 rapid tests, continue PCR testing for symptomatic students, and make rapid tests available to childcare centres. This is all good news and a big relief for parents. I'm glad the province is responding to our calls to reduce the risk of transmission in settings for our youngest learners, in childcare centres who can't be vaccinated or masked. My team has spoken to the leadership at both the Dufferin-Peel Catholic District School Board and the Peel District School Board, and they assure me that they are ready for students to return on Monday, with many of these resources having already arrived in their schools. In order to reduce risks in school settings, these resources need to continue to flow to our students as the surge resolves. It's also important that parents continue to have the option for their children to learn online, as understandably, some don't feel comfortable sending their kids back to school. I'm very happy for students to return to school with their friends and classmates on Monday and reap all the benefits that have come with in-person learning. Like everywhere across Ontario, Mississauga is grappling with high case counts due to the transmissibility of Omicron. This has put an enormous strain on Trillium Health Partners, who are seeing unprecedented demand on their system. Trillium currently has more than 300 patients in hospital with COVID, which is unfortunately the highest in the province right now. They have double the number of ICU patients that they had just a week ago, and several hundred staff members off due to illness or to isolation. Residents should be aware that Trillium has moved their vaccination clinic from the J Wing at the Mississauga Hospital to the Valley House at Credit Valley Hospital to open up additional space for inpatients. The Credit Valley Hospital vaccine clinic is open as of today. The situation in our hospitals reflects what's happening all across the province. Modeling suggests that Omicron could very well peak in the 3rd or 4th week of January, which means that the pressure on our hospitals will continue in the weeks to come. Right now, we're at a critical juncture, and we need all hands on deck to alleviate the pressure on our hospitals. I want to thank all of our healthcare workers who are taking on so much right now to provide essential care to those in our community who need it the most. I also want to thank the province for taking proactive measures to address staff shortages by working to recruit and deploy internationally educated nurses to hospitals and long-term care homes in need of support. I want to again assure Mississauga residents that despite these challenging times, our situation remains stable and the City of Mississauga continues to deliver the essential services that you rely on each and every day. As I mentioned last week, we have a plan in place that allows us to maintain critical services even if staff shortages got as high as 40%, although I'm quite hopeful we will never get to that point. And while we are experiencing some challenges on our transit system, with My Way having to temporarily suspend some additional service on some routes, they continue to operate to close to 90% capacity. Mississauga Fire and Emergency Services and Peel Police assure me that they continue to maintain their service levels as well. And it is encouraging that staffing levels at Peel Paramedics has improved this week as more paramedics have recovered and have completed their isolation. I also want to thank all the paramedics who are taking time away from their families and working overtime to help their colleagues. I want to congratulate and welcome the 34 new paramedics who will gradually join the team at Peel Paramedics this month to further boost the capacity on our 911 system. The single most important thing that you can do right now to help protect our hospitals, our frontline workers, and keep our schools open is to get your first, second, or booster shot if you're eligible. I'm very proud that 88% of Peel residents aged 5 and over have received at least one dose. 82% have received one dose, and 88%, oh, it's the other way around, sorry, and 82% have received at least 2 doses. I want to thank everyone who has stepped up to get their shots. I highly encourage those of you who haven't booked their booster shot to do so as soon as possible, with new appointments coming online daily on both the provincial portal and Trillium's. So please check back and see if you can get an earlier appointment. But if you do, please remember to cancel your prior appointment so it can be made available to someone else. And please take whatever dose that is being offered to you. An mRNA vaccine is an mRNA vaccine regardless of the brand. I've heard reports of people refusing a Moderna booster because of the risk of myocarditis, or they simply don't want to mix brands. But Dr. Lowe advises me that if you're over 30 years of age, it is very unlikely that you will get myocarditis, and studies suggest that Moderna may in fact give a slightly stronger boost against Omicron, though both mRNA vaccines are equally effective. So please, don't vaccine shop. For your protection, get whatever booster you can as soon as possible. I also believe we could be using other tools more effectively to help us get through this current wave. I'm pleased that Ontario has procured more than 65 million rapid tests in December and January and is expected to receive an additional 54 million from the federal government. We know that these tests will be prioritized for healthcare and congregate settings, and rightly so. But along with my fellow GTHA mayors, I believe the province should explore prioritizing rapid tests for all critical frontline services to help ensure staffing levels remain stable. At the City of Mississauga, rapid tests have allowed us to undertake targeted interventions to address outbreaks and keep critical services operating. And with the peak of Omicron still in front of us, I'm encouraging the province to once again prioritize municipalities for rapid tests. They are an effective public health tool that, combined with vaccination, can help reduce risks of transmission in the workplace and ensure that we can continue to provide vital services to our residents. It is abundantly clear that residents are also anxious to get their hands on rapid tests. New guidance from the province advises that if you have symptoms, please assume you have COVID and isolate, and that a rapid test is not necessary. While medical experts predict Omicron will soon be treated much like the common cold or flu and become endemic, until we get there, I do believe that the general population should continue to have access to free rapid tests, just like they do in other jurisdictions around the world. People want to play their part in limiting the spread, and I do believe we owe it to people to give them the opportunity to test themselves and their loved ones for their peace of mind and their mental health. Before I call up Dr. Lowe, I just want to quickly let residents know that the Mississauga Library has now gone fine-free, with late fees eliminated from customers' accounts. Our libraries are so important to the well-being, and eliminating financial barriers like late fees is an important way we're ensuring equitable access to our incredible library services. And lastly, I just want to again encourage residents to get outside and enjoy the incredible amenities that we have here in Mississauga. I went for a hike on Tuesday with a couple of friends along the Cullum Trail, and I was just thinking how lucky we are to have such incredible green spaces in our city. So please take advantage of all that we have to offer here at the city. Mississauga, please continue to be well and be safe. And now I'd like to invite Dr. Lowe up to give his update.
Thank you, Madam Mayor, and good morning. At this time, the Omicron variant continues to transmit widely throughout Mississauga and the region of Peel. This means that all residents should ensure that their vaccination status is up to date. If you have not yet been vaccinated with your first 2 doses, please do so as soon as possible if you're aged 5 and above. For those of you who have already had 2 doses, please access your booster as soon as you are able, particularly if you're older than the age of 50. Peel Public Health continues to make new booster appointments available every single day, so I encourage residents to check online at peelregion.ca/COVID-19 vaccine or on the Ontario booking portal. For our children aged 5 to 11 in particular, I can't stress enough how important it is to offer them the protection that the vaccine provides. The vaccine is safe and effective for children and will help to reduce risk in their interactions, protecting them from hospitalization as well as other rare and severe outcomes during this Omicron surge and beyond. For parents and guardians who have already gotten their children started on their journey to protection, thank you. You've made the right choice. I encourage all parents of children aged 5 to 11 to get your child's first shot today if you haven't already. For anyone, in fact, who needs a first or second dose, including our youngest residents, we are accepting walk-ins for first and second doses at all of our clinics. I want to draw our parents' attention in Peel to a special family clinic that we're having this Sunday from 1 to 8 p.m. at SaveMax in Brampton. We're family sizing vaccinations at SaveMax for 1 day only, and we can't wait to see you there. You can book an appointment for your child and get your booster shot all at the same time in the same appointment. To book an appointment for your family, please visit that website again, peelregion.ca/COVID-19 vaccine, or call the provincial booking line at 1-833-943-3989 3900 and book into SaveMax for this Sunday. Vaccination is crucial because we are now in a time of transition. Widespread Omicron transmission is already occurring throughout PL, which means that our focus is shifting in our approach towards preventing severe outcomes like hospitalization and death rather than infection alone. To clarify news reports on my comments from yesterday, given how widespread transmission is occurring in PL, we will all likely confront this variant in some manner in the coming months, either directly via infection or through exposure and close contact. This is why during the surge, adhering to precautions is more crucial than ever. Vaccination, of course, remains the cornerstone, and data is clear that the vaccine is extremely effective at reducing the risk of severity for individual residents. 6 times fewer hospitalizations and 10 times fewer ICU admissions are occurring amongst those who are vaccinated as opposed to those who are not vaccinated. This means that confronting the virus with 2 doses is good, and with 3, especially if you're over 50, is even better. The other precautions will help to slow spread during this surge and slow the rate of infection throughout our community, which is why if you or anyone in your household is sick, I ask that you review the provincial screening tool to determine if you should all need to stay home. Typically, this would be self-isolation for a minimum of 5 days if you're vaccinated or 10 days if you're unvaccinated. You do not need a test necessarily to confirm your diagnosis unless you fall into one of the groups specified by provincial testing criteria that are intended to protect our highest risk residents. Continuing to wear masks in public areas, well-fitted masks that cover your mouth and nose with no gaps, will also continue to help limit infection and slow the spread. I want to close by thanking our frontline healthcare workers, public health staff, and first responders who continue to keep people safe amidst this difficult transition. Our thoughts are also with those who are afflicted in hospital with this disease and their families. I know that there has been a lot of confusion and changes with all that has been unfolding during this transition. Omicron has necessitated this rapid change in our approach to managing COVID-19. Please know that while the coming weeks ahead will be very difficult as the acute care crisis comes to a climax, we do have the tools and knowledge that can be deployed to reduce risk in our day-to-day lives, no matter what is opened or closed, whether it be schools or otherwise. Getting vaccinated, staying home if sick, and wearing a mask remain critical as we begin what is hopefully a transition beyond the acute phase of the pandemic. We will get there. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And now, along with Dr. Lowe, we are happy to take questions from the media.
Mayor Crombie, your first question comes from Natasha O'Neill at The Pointer. Go ahead, Natasha.
Welcome, Natasha.
Good morning. 2 questions for Dr. Lowe this morning.
Okay, no problem.
Thanks, Madam Mayor. Go ahead, Natasha.
Good morning. My first question is this the highest ICU capacity we've seen at Trillium Health Partners in the pandemic so far?
So thanks so much for the question, Natasha. You'd be best to direct that question to Trillium Health Partners. However, I can tell you that that all of our area hospitals are seeing, significant pressures. The reason for these pressures are twofold. A lot of it is driven by the fact that we have a highly vaccinated population, but we also have a high absolute number of individuals who are unvaccinated. So it is that high absolute number of individuals who are unvaccinated that continue to drive the cases of severe hospitalization and ICU demand, and also necessitate the continuation of isolation protocols that are designed to protect them, which are driving staff absenteeism levels as well. So it's a bit of a double whammy for all of our hospital and acute care partners, but if you want specifics on the actual numbers, I would encourage you to reach out to each specific hospital system. Thanks for the question.
And my second question is a little bit of a double whammy. I'm just kind of wondering what types of people should be getting a fourth shot, and is there such a thing as too many shots or boosters with these vaccines?
Thanks so much for the question. No, there isn't such a thing as too much boosters that we're aware of at this time. We obviously continue to follow the evidence, and the evidence is clear that with Omicron, at this time, the recommendation is people get boosted if they've had an initial 2-dose series. For more vulnerable populations, recognizing that getting that extra dose is helpful for those with robust immune systems, the province continues to recommend that individuals who are severely immunocompromised, as well as individuals severely immunocompromised with a physician referral, as well as individuals who are residents in long-term care facilities, get a fourth shot at this time. Thanks for the question.
Thanks very much. We're ready for the next question.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Crombie, how are you?
I'm very well. How are you feeling?
Not too bad. Thanks for the well wishes last week. I appreciated that. Just wanted to ask about this plan the city has in place for up to 40% of employees kind of being off due to COVID stuff. I understand the situation is probably fluid, but could you tell us kind of first what level of city employees are currently off, and then just on this piece about My Way kind of route cancellations, is the city kind of prioritizing, and are they pledging to keep My Way routes that are servicing students as they go back to school, or are they pledging to keep those in place as students are heading back to class?
So lots of questions and very thoughtful questions. First, let me say that our staffing levels are very stable. In fact, they're very similar to the levels we were experiencing a year ago at this time. And so we have contingency plans should we need to ramp up or ramp back down, and those can be employed quite easily at many of our departments. Certainly the situation at My Way, we're operating at almost 90% capacity, notwithstanding we did add 2 new routes that are being suspended. We've had to temporarily cancel an additional route. We have suspended the routes 110 University Express and the 76 City Centre subway, and that is in addition to the 101 and the 101A, the Dundas Express, and the 107 Malton Express, and also reduced frequency of service on the 103, the Hurontario Express. So yes, of course, we have to prioritize students, but we have a city of residents that also use public transit. So we're being very mindful to make the least impact and maintain service levels at a 90% capacity, Steve.
Thank you. I think my follow-up question is for Dr. Lowe.
Sure, no problem.
Dr. Lowe, I just wanted to ask about the uptake so far for vaccinations for kids 5 to 11. Just looked at the Peel health data this morning. It looks like 36% have had 1 dose in Peel to date, 47% in Toronto. The same age demographic have had the 1 dose, and looks like 61% in Halton. So I was just curious, on one hand, what your thoughts on why Peel has had a lower kind of uptake so far for 5 to 11, and if the region is kind of considering any additional steps to get that younger demographic kind of to get the shot, kind of, especially if they're heading back to school.
Yeah, thanks, Steve. So thanks so much for this question. It certainly hasn't been for lack of trying, and the 37%, 37.9%, I believe the dashboard may not be updated as of yet with our total, does not necessarily reflect the tremendous effort and sacrifice that our teams have put into making sure that this population gets vaccinated. There's a few things that are contributing to the disparities you're seeing with other health units. First of all, it's simple math. Here in the region of Peel, we have a higher proportion of 5 to 11s than many of the other comparator health units that you're describing. If you think about the nature of our community, we have large families, lots more residents. So proportionately relative to Toronto and Halton and Ottawa, we have larger families and more 5 to 11. So just we've actually delivered the 3rd or 4th largest absolute number of shots in that age group in Ontario. But because we have so many children, the denominator is a lot bigger. The proportion proportion looks a little smaller. Secondly, we have a very different community. It's diverse socially, culturally, economically, and so we know we don't have a lot of a large affluent laptop class like many of these other health units do. We've got hardworking, folks that work in manufacturing and in factories, et cetera, where it is a little bit more challenging for them to find the time to actually get there. That's why our teams are working in so many different places, in community pop-ups, in school clinics, and this is harder because we're kind of going almost like door to door, like basically trying to get needles in there. And while we're doing that, we're also building trust amongst our very diverse community. Together with community ambassadors, we have many ethnocultural and diverse differences in the views and groups here, especially around medical interventions and institutions that we have fought against, not just with this rollout, but throughout the entire pandemic. So it is a hard work, a lot of challenges that we have continued to face and overcome. But we just have more 5 to 11s and a far more diverse and different community than some of the other places that you've mentioned. But that's not going to stop us from doing the tremendous work that we've continued to be doing. And I know our team continues to work around the clock to make sure that 5 to 11s can get vaccinated. I think the message for our community is very clear. If you're a parent with children aged 5 to 11, like me, I would encourage you, I was out there the first night that this opened, I would encourage you to get your children protected, especially with schools going back in. Give them the very best protection and the peace of mind that your family deserves. Thanks so much for the question.
Next question, please.
Your next question comes from Declan Fennekin at Mississauga. Go ahead, Declan.
Welcome, Declan.
Good morning, Mayor Crombie. How are you?
I'm very well. How about you?
Good. I'm well, thank you. Just to piggyback on Steve's question regarding the contingency plans should staff shortages reach 40%. If that were to play out to 40% in any area, what specific measures would the city put in place to allow the services to continue being delivered? And would it be a continuing of delivery of services at current levels, or would it be sort of a provision of lesser services?
You know, it's an excellent question, and I have to say that I'm very hopeful that that's just not going to happen. It hasn't happened to this point, so I'm quite confident that it won't. But I must say that I want to congratulations to our staff because they have very robust, comprehensive business continuity plans in place that allows them to ramp up should they need to, and cover for each other, redeploy resources, or ramp back down should they need to. And so I'm confident that our residents won't notice any service impacts, notwithstanding that My Way is operating at about 90% capacity now. Very few people will feel that difference. So I'm very confident that this situation won't change going forward either.
Follow-up, Declan?
Yes, for Dr. Lowe, please.
Certainly.
Great. Go ahead, Declan.
Great. Good morning, Dr. Lowe. I'm just wondering if the COVID-19 numbers in schools significantly rise in the coming weeks or so, at what point and under what scenario or circumstances could you or Peel Public Health close any schools?
Thanks so much for the question, Declan. I don't anticipate closing schools again. In fact, I am very supportive of this move to reopen schools because we are in a very different situation from previous waves. I know that there's a lot of concern and anxiety out there, but I have to point out that we are a highly vaccinated population, in terms of, again, the approach now being to really try to limit spread as much as possible, but really a bigger focus on preventing severity and hospitalization. It is positive to see just what measures the provincial government has put in place during this time of transition, with the ventilation, with the masks, with the rapid tests that are coming forward just to get us through this period of transition. And then certainly the fact that most of our population is now highly vaccinated, both staff as well as students in the 12 to 17 and with the 5 to 11s continuing to creep slowly upwards. So I strongly do not foresee a possibility where we would consider closing the school system again. There is a reality that schools often do remain open, even pre-pandemic, with a recognition that there are certain risks that are inherent to the school setting, infection or otherwise, and I don't believe it would meet that threshold for closure. So I think certainly the big thing is for people to continue taking the steps that we know will protect them, not just in the school setting, but in any setting in our community. Getting vaccinated, staying home if you're sick, wearing a mask, ventilation, popping open a window if you can. I mean, these are all things that we know how to do, especially in the face of our current context, which is vastly different from when we made a decision locally. Thanks so much for the question.
Okay. Next question, please.
Your next question comes from Khalid Salama at My Second Home TV. Go ahead, Khalid.
Welcome, Khalid.
I want to know whether the trails are fit and ready to for the use of the residents, especially whether there is winter maintenance or whatever. I know it is important for everybody to get some fresh air and get some workout as well.
So, Khalid, you were wondering if the trades.
I have a
I missed the word. I missed the word you said, because yes, certainly our winter maintenance program is robust, and as you can see from the snowfalls we have already had, that they've been in place and servicing our residents. What was that?
Very well. Okay. Yeah. Can you hear me now?
I can hear you now. Please repeat.
Very well. Yeah. It's about winter maintenance when it comes to trails. Yes. Okay, thank you so much. The follow-up will be for Dr. Lowe, please.
Absolutely.
Yes, please. Thank you so much.
Morning, Khalid. Go ahead.
Dr. Lowe, good morning, how are you, sir? If there is a low probability of getting complications because of vaccine mixing, and if they say if you are in a doubt, just leave it. Why you think they should be encouraged to get this vaccine mix if there is still very mild or low odds to get complications?
Sorry, Khalid, I apologize if I didn't convey my message earlier on in a way that was clear. I apologize. The Omicron variant is certainly milder. It's not necessarily mild, but it's milder than ending up hospitalized or in ICU for individuals who are vaccinated. So for individuals who are not vaccinated, let me be very clear that their risk of severity, ICU and hospitalization, is almost on par with Delta and pretty much the same as this entire novel virus. This virus is as new to your immune system if you're unvaccinated and uninfected as it was in January 2020. So certainly we encourage everyone to get 2 doses of an mRNA vaccine as quickly as possible if they're unvaccinated in the midst of this Omicron surge to reduce those risks quickly. And for those who already have 2 doses, you're doing pretty well. That's a good foundation. But especially if you're older than the age of 50, we certainly recommend that you get boosters as soon as possible and take whichever mRNA booster is available to you, because right now we are having widespread Omicron transmission in the community, and it's important for people to ensure that their vaccination status is up to date. Thanks so much for the question.
Thank you.
Khalid, before you go, I just realized you were asking me about the trails. And I was just so happy to report that I had the opportunity this week to have a hike along our Cullum Trail, which is so well kept and manicured. And it's such an enjoyable experience. We have over 300 kilometers of trails and cycling paths. And now that indoor amenities, indoor recreational amenities and gyms are closed, I encourage everyone to get out into the outdoors and enjoy what we have to offer in our beautiful city, whether they're the trails, the biking paths, the toboggan hills, the outdoor skating rinks. We have 2 run by the city and 43 other natural skating rinks, and encourage everyone to come on out. I know one of my favorites is Celebration Square. I love having to skate right here at the office. So yes, we do encourage everyone to enjoy the trails that are being maintained. Thank you.
Yes, I'm sorry about the audio because it was cutting.
Yes, I apologize. Thank you. Next question, please.
That was your last question for the day, Mayor Crombie.
Thank you. Thank you all for joining us today.